Question number 1.
Nurse Mimi is providing education to group of students. She doesn't need further teaching if she says that the liver receives its blood supply from two sources. The major source is called blank, which is a vessel network that delivers blood blank in nutrients, but blank in oxygen. A. Hepatic portal vein, high in nutrients but low in oxygen. B. Hepatic artery, low in nutrients but high in oxygen. C. Hepatic lobule, high in nutrients but low in oxygen. D. Hepatic vein, low in nutrients but high in oxygen. The correct answer is letter A. Hepatic portal vein, high in nutrients, low in oxygen. Majority of the blood flow to the liver comes from the hepatic portal vein. This vessel network delivers blood high in nutrients such as lipids, proteins and carbohydrates from organs that aid in the digestion of food, but the blood is poor in oxygen as it is a vein not an artery, so it is a blood that returns back to the heart for reoxygenation.
Question number 2.
As Nurse Mimi continues with the discussion, she says that the blank reside in the liver and help remove bacteria, debris, and old red blood cells. A. Hepatocytes. B. Langerhans cells. C. Enterocytes. D. Kupffer cells. The correct answer is letter D. Kupffer cells. These cells play a role in removing bacteria, debris and helping the hepatocytes turn parts of the old red blood cells into bilirubin. Hepatocytes are mainly involved in carbohydrate, lipid, and protein metabolism. Langerhans cells reside in the epidermis of our skin, which determines the appropriate inflammatory response. Enterocytes are found in the intestine. It ensures the uptake of ions, water, nutrients, and vitamins.
Question number 3.
In continuation of liver biology, Nurse Mimi is correct when she says that the following are functionalities of the liver, except A. Removing hormones from the body. B. Producing bile. C. Absorbing water. D. Producing albumin. Let's apply the process of elimination. Liver breaks down estrogen and eliminates it from your body, making option A a correct statement. Liver produces chemical that helps turn fats into energy, which is called bile, and store it to the gallbladder, making option B a correct statement. Water absorption is done in the small intestine and not in the liver, making option C incorrect. Synthesis of albumin takes place in the liver, after which it is excreted into the bloodstream, making option D a correct statement. Therefore, the correct answer is letter C.
Question number 4.
Bryan was admitted to the hospital with ascites and jaundice. To rule out cirrhosis of the liver, which laboratory test indicates liver cirrhosis? A. Decreased red blood cell count. B. Decreased serum acid phosphate level. C. Elevated serum aminotransferase. D. Elevated white blood cell count. The correct answer is letter C. Elevated serum aminotransferase. Hepatic cell death causes release of liver enzymes aminotransferase into the blood circulation. Therefore, an elevated result in the lab test would indicate a possible liver cirrhosis. Here are 5 common causes of liver cirrhosis. Excessive alcohol consumption. The liver breaks down most of the alcohol you drink so that it can be removed from the body. Large amounts of these substances can damage liver cells and cause serious liver disease. Injury. Injury or prolonged obstruction causes biliary tract, can also lead to liver cirrhosis. Hepatitis. Chronic infections with hepatitis B and C virus are the major causes of cirrhosis globally. It takes 10 to 20 years to progress from viral hepatitis to cirrhosis. Right-sided heart failure. This results in hepatic venous congestion that may predispose the liver to hepatic injury. Other diseases such as hemochromatosis, a genetic or acquired disorder in which iron-binding protein accumulates in various tissues, typically leading to liver damage.
Question number 5.
Bryan develops hepatic encephalopathy. Which clinical manifestation is most common with this condition? A. Hypotension. B. Altered level of consciousness. C. Decreased tendon reflex. D. Increased urine output. The correct answer is letter B, altered level of consciousness. Encephalopathy is a condition in which the function of the brain is affected by certain illness or disease. Hepatic encephalopathy happens when the liver is unable to convert protein metabolic product ammonia to urea, which results in accumulation in the blood, damaging the brain cells, leading to changes in behavior and level of consciousness of a patient.
Question number 6.
Bryan was admitted with hepatic encephalopathy secondary to liver cirrhosis. Which meal option selection below should be avoided with this patient? A. Cucumber sandwich with a side of apples. B. Pasta noodles and bread. C. Beef tips and broccoli rabe. D. Fresh salad with chopped banana. The correct answer is letter C, beef tips and broccoli rabe. Patients who are experiencing hepatic encephalopathy are having issues with toxin buildup in the body, specifically ammonia. Remember that ammonia is the byproduct of protein breakdown, therefore the patient should consume foods low in protein.
Question number 7.
Nurse Mimi tried to gather client history of Bryan, who was diagnosed with cirrhosis. He has a long history of alcohol dependence. During the late evening following his admission, he becomes increasingly disoriented and agitated. Which of the following would the client be least likely to experience? A. Diaphoresis and tremors. B. Increased blood pressure and heart rate. C. Delusions of grandeur. D. Illusions. Let's apply the process of elimination. Alcohol is considered as a central nervous system depressant. Therefore, a withdrawal would cause an opposite reaction. Thus, increase in sweat, also known as diaphoresis, and increase in hand movement, which is tremors, is expected. Increased in blood pressure and also with heart rate are symptoms observed for patients with alcohol withdrawal. Delusion of grandeur is defined as false belief in one's own superiority, which is for manic patients and is not from a patient with alcohol withdrawal. Illusions happen in dim, artificial lighting where the environment is not perceived accurately by patients with alcohol withdrawal. Therefore, the correct answer is letter C.
Question number 8.
While providing mouth care to Bryan with late-stage cirrhosis, you have observed a pungent, sweet, musty smell to the breath which is known as A. Metallic hepatico. B. Fetor hepaticus. C. Hepaticoacidosis. D. Asterixis. The correct answer is letter B, Fetor hepaticus. One of the major effects of liver disease is that the liver may not filter out compounds that contain sulfur. This means they stay in your body, resulting of increased dimethyl sulfide in the air that you exhale, causing Fetor hepaticus.